you ever known someone who suffered from a terminal illness? Well, there's a way to end people's suffering, scientifically, and there's two terms for it. There's physician-assisted suicide and there's euthanasia. For this project, we decided to interview random people and see if they know the difference between the two terms. What's the difference between euthanasia and physician-assisted suicide?
Euthanasia and physician-assisted suicide.
Euthanasia is an individual's choice to end their life. Physician-assisted suicide is when a physician actively goes against medical doctrine in the U.S. and assists you in dying.
Euthanasia, I generally think refers to, good question.
I would think physician-assisted suicide is just like when the patient can't commit suicide themselves, then they ask for help, and that's like the only way that they can do it. But euthanasia is being put to sleep, I guess.
What's the difference between physician-assisted suicide and euthanasia?
Euthanasia.
I've always considered euthanasia to be something that is, I don't know, you have to bring a dog to the pound and they have to euthanize it because it is sick or something like that.
I'm not really sure, but I'm going to say that the difference is that in euthanasia, the doctor decides to put the person out of the misery, but in assisted doctor suicide, the person requests him or her to assist in their own suicide, because suicide is more of the person's choice. So I'm not really sure, but
What?
Isn't the difference like assisted suicide you give consent to doing it? Euthanasia is kind of just like putting them down like a bed or something.
Euthanasia I associate with veterinary medicine, and usually associated with delivering a drug that stops the heart.
I know one has more of a
Physician-assisted suicide is exactly as it is described. Are you looking for a moral equivalent or something like that?
So from what I understand, there's two forms of euthanasia. There's active and passive, and currently in the American healthcare system, passive is allowed, but active is not. So I feel as if active euthanasia is kind of equivalent to physician-assisted suicide, which is currently not allowed in America.
Do you know the difference between euthanasia and physician-assisted suicide? No. That's okay, thank you.
I guess I really don't know. I guess they're pretty similar. So,
As far as with humans and physician-assisted suicide,
I'm probably not as up to date on the topic as maybe a lot of people are, so I don't know.
I did a debate on this in like 12th grade. So, but I kind of forget the difference. But I know that it's like patient choice is also some factor.
I guess it doesn't have to be a drug targeted for euthanasia, and the difference would be with assisted suicide, it could be drugs intended for pain relief, like analgesics, narcotics.
I don't know. This falls into the whole realm of politics, religion, and everything else, and it's probably not going to be solved anytime in our lifetimes. So.
While few people that we interviewed had some basic concept of the two definitions of euthanasia and physician-assisted suicide, most of the time people did not really understand the difference, which is very common because the two terms are very closely related. Euthanasia is when a doctor physically ends a patient's life with their consent. However, physician-assisted suicide is when a doctor gives the patient the means to end their life, and they do it on their own. While many like to make a topic based on the right to live and the right to die, based on morals and ethics, one has to consider the scientific considerations behind such a highly controversial topic. Euthanasia and physician-assisted suicide may affect the availability for organ transplantation. There was a study done in Belgium, according to a journal on transplant proceedings, where 4 individuals went through euthanasia and their organs were successfully transplanted. There are many economic aspects to consider when dealing with euthanasia and physician-assisted suicide. While it costs $35 to $45 for the drugs to end one's life, like the lethal injection, it costs $35,000 to $45,000 for health care when someone is undergoing such a terminal illness.
When a person is dying or in pain, is it okay or moral to end their lives? We interviewed many people to find their opinions on this very important matter. Is it okay to put them out of their misery? For their own sake?
Well, first off, I think sometimes the mercy killing is more about the person that's looking at the person suffering, and they are suffering because of seeing this person suffering.
The merciful thing to do is try to help them die naturally, in a natural way. Because, there's a line we have to walk, and we can never directly kill another human being.
People who are suffering and want the chance to end their life should have that option, not based on morals, ethics, or religious values, but based on scientific evidence that more people will have the chance to live from organ transplantations and more people will benefit from the economic aspects of euthanasia and physician-assisted suicide.
So I'll just walk right out the door. Played a game right from the start. I trust you, you used me, and now my heart's all torn apart. I'm sailing